Hello people. Today I am going to talk about functional anatomy of the heart in a very simple and straight-to-the-point manner. The heart is located in the region of the thorax called as the middle mediastinum. It is enclosed in a cavity called as pericardial cavity, which is the potential space between the parietal and visceral layers of serous pericardium. It normally contains a thin film of fluid that enables the heart to contract and relax in a frictionless environment. We can divide the heart in two parts, right and left. The right and left part is divided by a structure called as septum. The septum is further divided into interatrial septum separates the two atria, whereas an interventricular septum separates the two ventricles. The human heart consists of 4 chambers. Think of chambers like a room. There are 2 atria, right and left, and 2 ventricles, right and left. The atria are receiving chambers, whereas the ventricles are ejecting chambers. The right atrium receives blood from the great veins, superior and inferior vena cava, and transfers the blood into the right ventricle. Between the right atrium and the right ventricle is the tricuspid valve. The right ventricle pumps blood into the lungs via the pulmonary artery. The pulmonary artery is guarded by semilunar valve. 4 pulmonary veins bring blood from the lungs into the left atrium, which pumps blood into left ventricle. Between the left atrium and the left ventricle is the bicuspid valve. The left ventricle pumps blood into the systemic circulation, all over the body via the aorta. Guarding the aorta is the aortic semilunar valve. All the venous blood reaches right atrium through superior and inferior vena cava. In this way, the 2 cardiac pumps, the right and the left heart, work in series. Other than that, the wall of each chamber of the heart consists of epicardium, which is the outermost visceral layer of serous pericardium. Myocardium, the thick middle layer composed of cardiac muscle fibers. Endocardium, the innermost layer formed by the endothelial cells and subendothelial connective tissue. These are some questions that can test your remembrance of the topic. Pause this video and try to answer them. Answers are posted in the pinned comments below. That's all guys regarding the functional anatomy of the heart. If you find value in this video, please like, comment, and subscribe. If you have any biology topics that need discussion, send them via the Google form that I have linked below. If you have any comment regarding this tutorial, kindly post your comments below.